السلام عليكم ورحمة الله وبركاته. سلام السلام كان يكون سلام يا مركا آد بروم هالعلنا يا ضدك والدين تأه متغني معموين كي وضياشة علماء كسوق يبقلي أرنتن health care كبرشة إنه مهم بويه هاي عافماتكم مهم بويه هاي وحدوكتين كار كهوري اللي هيستين يسبدلين كار عصبي مادين Medica ayaa mataqaanay noqon doonta default ama choice koobaad ee qofka Hennepin County degan ee government programmeska ku jira uu yeelan doono marka waxaan ku martiqaanay Medica inay noo timaado oo leadership koodii oo mataqaanay Soomaali iyo dad aan Soomaali ahayn bale inay noo sharxaan hadii Ilaahay ka raali noqdo change-ga dhacay waxa uu noqon doono su'aalihii aynu qabno أنا سجن عن ويدينه مركب وحان ربنا إن شاء الله سود وهذا first of all I would like to welcome you all of you to come to this evening to Eden Prairie Community Center as the director of New American Academy. I would like to say thank you so much. I call you many times in community events. I think last Saturday we had a big event in this room, so I really appreciate your time and effort and energy to answer my call whenever I ask you to come. As you know, New American Academy works through the community in terms of community engagement and outreach for housing and jobs, economic development, health, and youth. Since the state health RFB program changed about a month ago, there is a insurance companies who are going to be the default in the Hennepin County. So Medica is going to be one of the key provider to our communities, low-income communities, communities of color, people who get a medical assistance from through the state programs. So it's my honor to welcome and bring Medica staff and personnel to come to our community and share with us how those programs will be, what kind of services we will get, and what change will happen, and who that change is going to affect. We have Medica Government Programs Director Kenneth Pence with us. We have a community engagement personnel, Maura, and our two sisters from Medica, Anissa, Issa, and Samsam. So I would like to welcome those four of the from Medica staff to our community and share with us what kind of resources and opportunities that we're going to have through this change and through this transition. This event is specific for information sharing, question and answer, and about the transition and those change. So I would like to say thank you, and I would like to Ahmad Jama, a long-time community volunteer and a dedicated member of our community, is going to host, coordinate for this, and he will translate into Somali whatever the English language speakers, our guests, will say. He will translate into Somali, and inshallah, your question is also. If it's Somali, will be translated to English by Ahmed. So I would like to say welcome, Ahmed. Thank you.
Thank you, Asad. Bismillahir Rahmanir Rahim. Assalamu alaikum. Kusoo dhawaada habeenkan caawa oo ugu talagalnay inaan dadka ku wacyigelino nidaamkan cusub oo bilaaban doona January 1-deeda. dadkii wixii ay yaqaaneen dhan baa la bedelay marka qolo walba mar baan u yeeraynaa si ay dadku ugu sharxaan nidaamka cusub iyo soo saameyn doona qof walba marka dhageysi fiican caawa dadkii madaxdu waa habaan ali jooga wixii su'aalaha qabtaana waa noo soo gudbinaysaan annaga idin weydiin doona. Good evening, ladies and gentlemen. Thank you for coming tonight. The objective of this evening is to educate our community this very complicated subject, which is the transition of the healthcare system. We have Medica management who are here to answer your questions, and to educate you. First of all, what is Medica? And he will tell us how it fits into this transition, how it will affect our community, our families, and anything else you would like to know, you can ask him, and he will answer. I would also like to know if Medica is well equipped to handle immigrant needs, like translators, interpreters, people who understand these people's culture. Do we have enough Somalis in the system that can help our community? Once Ken finishes his speech, I'll interpret it for you in Somali, and then we'll go from there to question and answer sessions. Please help me welcome Ken Pence, Director of Public Health.
I want to thank Assad for inviting us here tonight. I've known him for almost a year now, and these kind of events are very helpful. And so we want you to know who we are, so we know who you are, and that helps have a good relationship. And as Assad said, I would like to thank my community engagement team that's in the back to come along tonight too. So, as I was introduced, I am the Director of Public Health at Medica, which means I am one of the staff at Medica that does a lot of meetings in the community. And so I've been around a lot, certainly in Hennepin County, but in other places as well. And so Medica takes very seriously that to serve your community, we need to be involved and engaged with your community. And so we have a number of staff that are active with different kinds of committees and meetings in the community so that we understand what the needs are. Medica has been around for 40 years. We started in 1975, and we are a Minnesota-based health plan. So this is our home just like it's your home. And we have been active with medical assistance and Minnesota Care since they started in Minnesota. And Hennepin County was one of the first that started. So we've been here that whole time, since the 1980s. And so even if you're in a position now where you have to change who your health plan is, I want to make sure that you know that Medica has been here all along. And so we are very familiar with the community and with some of the needs and who the providers and doctors are that are available to you. So I'm here to talk about the transitions in health plans that's going to happen in January, so about 2.5 months from now. So right now in 2015, if you're on medical assistance or Minnesota Care, you could choose Medica, you could choose UCare, you could choose Health Partners, or you could choose Hennepin Health. In January for next year, your choices will be still Medica, Blue Cross Blue Shield, or as they call themselves, Blue Plus, and then still Hennepin Health. So only 3 health plans will be available. And like I said, Medica has been here before, and Medica will continue to be here. So in this whole idea of transition from changing from one health plan to another, this is not new. People change health plans all the time. So we know very well how the process works. What's different this time is that the number of people, more people will have to switch for January than we've ever had before. So there's a lot more people, but the process happens all the time. So this is not a new thing. If it's new for you, you need to know that Medica is available to assist you. Hennepin County staff are available to assist you. And if you're going to different doctors, often their office staff are available to assist you. So by now, if you are on medical assistance or Minnesota Care, you should all have gotten a letter from DHS, from the State Department of Human Services, telling you who your health plans are that are available for next year, 2016. And as I said, it's Medica, Blue Plus, and Hennepin Health. So if you already are in one of those plans, you don't have to do anything if you're happy and you want to stay there. If you have UCare or Health Partners, then you do have to switch and you have to choose one of those other 3. We, Medica and the state, want you to make a choice. They want you to send your letter back and circle the plan that you choose. The sooner you choose, the sooner we can help you because you've made a choice to whichever one, Medica, Blue Plus, or Hennepin Health. But if you don't know which one you want to choose, or if you don't do anything, if you don't choose anybody, in December, before January, you will automatically be assigned to one of the plans. It'll probably be Medica, but if you know now that you want to choose Medica or one of the other ones, you really should circle that and send your letter back so that so the state knows that who you're going to transition to, because we want the plan you're currently on to tell us about what your needs are. The earlier we get that information, the better we can help you with the transition. So we want you to make that active selection and send your letter back. So if you currently have a health plan that you're going to change, if you're in the middle of some kind of a treatment plan, if you've got a chronic disease and you're under some kind of a case management or disease management program, if you're under case management for other services, if you're currently pregnant and already have a doctor, again, the sooner we know that, the sooner we can make sure that we're communicating with that doctor so that we're involved in that transition of care. Medica has a very large network of doctors. Almost all the doctors in the state of Minnesota are part of our network, and that's certainly true in Hennepin County, which of course is the largest county in the state. Now, some of you that would switch to Medica from another plan, it's possible that you would be working with the doctor that's not currently in Medica's network. And if that's the case, again, we want to know that because we will continue to cover that doctor, even though they're not in our network, for up to 4 months after you transition to make sure that we can get your care transitioned to another doctor that is in our network. So that's 4 months, January, February, March, and April, to make that transition happen. We also work with a number of partners that help provide the care and services to all of our members. So for example, if a person is getting dental care or orthodontic care, like braces for their teeth, Delta Dental of Minnesota is our partner for that. If a person needs treatment for chemical dependency or mental health, we use a partner called Medica Behavioral Health. If a person needs prescriptions filled and they go to their pharmacy to get a prescription filled, there's also a partner that manages those claims. It's called MedImpact. So there are a number of partners that work with us, and we are communicating with all of them. So again, we make sure that the transition of care, all of us are involved together so that we're all making this work smoothly. So as these transitions happen, Medica expects that we will have more members in Hennepin County in January than we do now. Our membership will grow because there will only be 3 health plans available in January. We expect that our number of members who are Somali or other ethnic communities will also grow. And so we are making arrangements now to increase our staff, to hire more people on our customer service phone lines, in the behind the scenes kinds of things, so that we can support all the members and all the transitions and their questions and help with all those things. We're also working on expanding our network of partners like transportation providers and interpreter providers, again, because we have more members to serve, so we'll need to have more people that can provide those services. At Medica, we like to be innovative in the things that we do. For example, we were the first health plan in Minnesota that started offering transportation services way back in the beginning, even before it was a mandated benefit by the state. So we kind of started that. We were also the first plan that hired customer service representatives that spoke key languages other than English, so that members could call and speak to somebody in their own language by having their own direct phone number. And Zamzam, who's here, comes from our customer service line. She's one of our Somali language line service representatives that can help assist you. So we are going to be hiring more people like that, again, to answer telephone calls and answer questions, and you can call a specific line for your language and get somebody right away that you can speak with in your language. In the last, since July, between July and December, we're going to be meeting with more than 200 community organizations just like this to make sure that we're talking to people and have opportunity to answer a lot of their questions. And we want people to feel that, we've got this covered. We know how to do this. We do this all the time. This is what we do. So let us take care of you. Let us make these transitions smooth for you. And then everybody hopefully has a good, happy relationship. I'm going to talk a little bit more now about some of the detailed benefits and services that you should know about. As I said before, we have a very large network of doctors. Almost all the doctors in the state are part of our network, so we've got a lot of that covered. We'll be increasing our transportation providers, working with interpreters and things like that. Because all the health plans are operating under the same contract with DHS, we all have the same basic set of benefits that we're required to cover. So the benefits that you have today, even if it's not with Medica, you will still have access to those benefits. There are certain things that all the health plans do that are above and beyond that mandated benefit set. And so we want to be able to introduce you to the things that we do at Medica that may be helpful for you. A good example of something that Medica does that goes above and beyond what we're required to do is we will provide incentives to our members to do certain things for their health care that are helpful that we want them to do. So for example, if a woman is pregnant, we want that woman to have prenatal care, to be able to go to a doctor throughout her pregnancy so she has a healthy baby. So we provide incentives via gift cards for prenatal visits throughout the pregnancy. We also have another incentive for a postpartum visit after they have the baby, because that's a very important visit also. Once the child is born, their child and teen checkups visits are also very important. So we have gift cards available for each child visit from when a child is born until they turn 21. For these gift cards, for any of you who have been with Medica for a while, you know that we've always had Target gift cards. And we were the first ones that started the program for giving Target gift cards for doing certain things. And that started, I believe, in 2001. A couple years ago, we expanded and added Walmart gift cards so that there was another option for people to use those gift cards at the store. Starting in January, we're going to go to strict Visa credit card or Visa gift card. So you can go to any store. It doesn't have to be a Target or Walmart. You can use a Visa card anywhere. So we're trying to make that more convenient because that's what members told us they wanted. Some other things that we have incentives for are for men and women to get cancer screenings. For breast cancer or cervical cancer, we want, and also for colon cancer. And we also have free car seats and free booster seats if you're on medical assistance or Minnesota Care. And then we have books available that help give advice on what to do for certain things regarding child's health, pregnancy care, asthma care, and elderly care. And then a couple of other things. If you have children, in the summertime, we pay for children to go to asthma camp if they have asthma, diabetes camp if they have diabetes, and for a weight camp if they're overweight or obese. And so these are ways that we can help kids learn how to live, be healthy, and be active even though they have those conditions. And so we cover those camps as well. And if you're on Minnesota Care, we do offer discounts for gym memberships. So if you have, I don't know if the community center here has a gym and that they charge for it or not, but Lifetime Fitness or their YMCA or whatever, you can get a discounted membership to those kind of places if you're on Minnesota Care. So the last thing I want to talk about is, as I said before, if you got your letter from DHS, the best thing to do is to make a selection and circle it and send it back. So the sooner you get you notify them of who you want your health plan to be, they can start that transition. I believe the letter will also talk about you can do that by phone if you'd rather do it over the telephone, and the Hennepin County can also help you with that. So there are a couple different ways to make your plan selection. If you're not sure and you want to get information about the plans, there's a phone number on that letter to call DHS, and they will send you packets of information about the different health plans. So Medica, Blue Plus, and Hennepin Health, and you can look all that information over, and that might help you make a decision. Once you make a decision and once you become enrolled with Medica, if that's who you choose, then we send you a packet of information welcoming you as a new member, and it includes lots of information about the benefits available to you and things like that. And it's a thick packet of information, so it can be very overwhelming. So again, you can always ask questions if you don't understand something, because there's a lot of information in there. I said that was the last thing, but I have one other last thing I want to say. So when you get your letter from Medica, once you choose Medica and you get your letter, it will have on there the customer service telephone number, either the direct Somali number or the general number. That number will also be on your membership card. That number is your friend. You can always call that number with any question you have, and they will direct you to the right person to help you with whatever you need. So that customer service number is very, very important, and we really do want you to use that. We really do want you to call when you have questions, because that way, if you're not sure about something, or if you assume something is not covered and it really is, we want you to know that it's covered. So please don't be afraid to call our customer service. So that was just some general information, but I also want to make sure that you have a chance to ask any questions that you might have. So I will open it up for any questions from the audience. Well, we certainly do our best to match up the provider and the driver with who the member is and what language they require. Again, make sure when you call that you're clearly giving that as a preference. I would assume if you're speaking Somali to Medica that we would assume that that's the case. We do that as much as we possibly can, but it depends on your needs, how quickly you need to have your ride, and what we have available at that time. So it's trying to balance out everybody's needs. But to the extent that we possibly can, we try to match up that language connection. Is that correct? And you probably already know this if you're using transportation, but also make sure that we know if you've got children or other people coming with you, so that the right equipment can be included. So make sure that all that is clear. So the question is, if a person doesn't make a choice, can they change that and choose another plan down the road? And the short answer to that is yes. So only if you're on Health Partners now or UCare will you have to change. If you're with Medica now, or you're with Hennepin Health, if you want to stay with what you have and you're happy, then you don't have to do anything. And so there's no transition. You're going to stay with the same health plan. If you have to switch and you don't make the switch yourself, then you get put into what's called the default plan, which is probably Medica. But you do have a window of opportunity. I think it's 60 days after January 1st to say, you know what, I want to change it, and they'll let you change it. So you can make that change. Well, again, all the health plans work under the same rules of how we have to make transportation available. And so it depends on what your need is. So if it's a medical situation and it has to be urgent or emergent, we'll make those arrangements just like your current plan will. If it's after hours, during the night, just like every other health plan, we do have a 24-hour nurse line available, and so they will be available to answer the phone and help you determine what the best course of action is. So that same level of service is still available to you. So a little bit of history. Back before 2012, when the state started doing what they call these competitive bid transition processes, Medica was the largest health plan serving Minnesota Care medical assistants. We had many more members than the other plans. And we've seen that shift over time. So as of today, UCare is by far the biggest for enrollment, and Medica is number 2. As of January, because UCare is going away, we do expect that we will grow. And I forget, I think it's somewhere around 20% is what we're expecting. We won't know for sure until it actually happens, but that's what we're projecting. And that's why I said before, we're working on hiring more staff and ramping up, because we're going to have more people to serve and more questions to answer, so we want to make sure that we're prepared for that. So the way I see it, it puts Medica back to where we were before, and we're very comfortable with that because we're used to that. That's an interesting question. So the question is, will Medica help get members to other kinds of community events or religious events? So we are a health plan, and as I said before, the state is very careful about making sure that the services that are provided are allowed and what's permitted. So we are only allowed to provide transportation for medically related services. So whether it's a medical visit or a dental visit or behavioral health counseling or whatever. So what we provide is all related to medical needs. And actually, I'll add to that. So the question also talked about traditional care services. And there are a number of services that are considered covered benefits, like acupuncture and chiropractic and things like that. So if it's a covered service, we do provide the transportation for it. So the question is about cultural sensitivity training and support services in the community. I will assume that cultural sensitivity training is related to our staff, people who work for Medica and our partners. And that's part of the reason I've got a couple of my colleagues here who are from the Somali community. So in fact, Anissa participated in a panel discussion we had at Medica in August that was exactly targeted towards that. It was an in-service seminar for our staff to understand about 3 different ethnic communities that we're serving and what their understanding of health and healthcare are, how they use their insurance, and so the better we know the community needs, the better we can serve. So we do take that very seriously, and I think that's a very important part of how we provide good service to you. And then, like I said before, our objective is to be very engaged in the communities that we serve. So we want you to think of us as being approachable. You see us in your community, and we're there with you. Well, once again, thank you very much for being here, and I hope this was helpful. And please, don't feel like you shouldn't call us. If you have questions, please, I hope you feel free to call. Thank you very much.
What we learned today is a great asset to our community to learn the kind of choices we have and what the kind of transition we are going to face. So waad mahadsantihiin. Asalaamu calaykum waraxmatullahi wabarakaatu.